Hello, everyone. This is Dr. Mike Chua, physical therapist. And yes, we are here today at Jerry Physical Therapy. We have a special guest for today. Her name is Tonya. We'll be back in a few seconds. We're going to interview her, what she does, and everything like that. Okay, we'll be back. Yep. Hello. We are back. We are here at the Jerry Physical Therapy location here at Jackson, Tennessee. Check us out. But anyway, we have a special guest for today. Oh, again, if you can hear us, type in you can hear us. If not, type in not, because I haven't checked if I had the correct microphone. Let me check if we have the right microphone. Yep. I think they can hear us. All right. Well, today we got a special guest. Her name is Miss Tonya Lance from Southern Joint Replacement Institute. She is actually the director of physician and provider relations. And I told her, hey, come on, join us in our show, a little show, and then ask you who you are, what you do, and everything. So could you please tell us, Miss Tonya, who you are, what you really do? Why are you here in our Jerry show?
Well, it's a great question. And I'm out of Nashville. I work for Southern Joint Replacement Institute, and it's a group of 7 surgeons. They're a subspecialty of orthopedics. So they do very specialized surgery of the hip, knee, and shoulder. They're all fellowship trained, so they've taken that extra year of study to really help hone in those skills. And then they do 2,000 plus joints a year between the groups. So they're highly specialized, but they also do not only primary knee, hip, and shoulder surgery, but they also do those really complex patients or revision surgery. Maybe a first surgery did not go the way as planned for whatever reason. That our doctors can actually go in and actually do a redo for that patient.
We've been seeing a lot of that.
So, have you?
Yeah. I got one patient that she's been complaining about her knee pain and everything. And then when I did some manual stuff, checking her range of motion and everything, I feel like there's, a clicking sound there, and she had to go back and do a revision. So, So I know you're not a medical doctor, but
right.
So are there a lot of revisions going on because of is it because of the actual device or the strength?
It could be both. Again, I'm not a medical provider, but you may have some patients that had early on surgeries and maybe the devices were not as good or parts that were put in were not as good, but they're now making parts that last 20 plus years and the jury's still out because they don't know with the new types of products that they're coming out with. They don't know exactly how long those are going to last. So, but some patients just don't, for whatever reason, they don't have a best practice with their first surgery. Maybe they still have some pain, some swelling, inflammation. And our doctors, because they are subspecialists, have a way to go in and with their knowledge, really view that situation and see what needs to be done.
That's good. You really need to find a specialist, ladies and gentlemen. You just can't be just go to there's nothing real going to a general practitioner for general stuff. But if you really want to hone on and work out, just like heart. If I have a heart issue, would I go to a general practitioner? Maybe, for simple hypertension, but if there's really something going on there, I need to go to a cardiologist.
Exactly.
All right. If I have issues with my lungs, I can't breathe well. Maybe maybe every now and then I could go to my general practitioner. But if it's really like a really bad COPD, certain stage, right? You got history of smoking and everything, and really really bad. You got to go to a specialist, a pulmonologist. And same thing with joints and hips and knees and replacement. Yes, you can go to a general surgeon for those general surgery, but if you need that orthopedic touch, go out and check out Southern Joint Replacement Institute, right? Well, anyway,
And
yeah.
we have made it easier for them to
Mhm.
check us out too, because not only are we based in Nashville, but
Mm.
we have branched out to
Mm.
places like Union City and also Dixon, Tennessee.
Wow.
For people in your area, they do not have to drive all the way into Nashville
Mhm.
unless they want to get their hip done and maybe do a little boot scooting there
Mhm.
in Nashville afterwards.
Mhm.
But they can also go to a place like Dixon and not only see a surgeon there, but also have their surgery there,
Mm.
as well as Union City, and they can also do their surgery there as well.
Mm.
For many really complex patients, that is a discussion between the physician and patient, where they need to land, but those are certainly an option.
Wow,
For
it's amazing.
patients.
Well, I'm going to ask you that too. Where are the locations that you have? I mean, I know.
Sure, we have
Yeah.
we
Mhm.
have several locations now. Nashville proper. We have a Murfreesboro location. We have a Dixon location, Union City, as we're mentioned, and also we have an ASC that we're currently doing procedures at in Tennessee.
What is ASC?
That's an ambulatory surgery
Oh, okay.
center.
Mhm.
And we will soon have our office open there in Brentwood as well.
That's good. That's good. So, who are the different providers that you have there?
We have
Mhm.
7 surgeons. We have Dr. Michael Christie, Dr. David DeBoer. Both of them actually started the practice.
Dr. DeBoer.
And Dr. DeBoer actually is in charge of our research. We're one of the only orthopedic specialized groups in Tennessee that has its own research arm, constantly trying to look at the procedures, see what all's been done, seeing if there's any improvements that can be made. And we've actually throughout time now have some of the best outcomes in the nation. So, and then we have Dr. Craig Morrison, Dr. Jeffrey Hodrick, Dr. Travis Scott Curry in Dixon, and Dr. Robert Otto in Murfreesboro. Those are all in Nashville as well. And then we have our newest surgeon that we're excited to bring on board, Dr. Matthew Christie, who it happens to be related to his father, Dr. Michael Christie.
Oh.
So it's really kind of neat to have that father-son team.
So there's that personal touch there, right?
Definitely a personal touch. Dr. Christie, Matthew Christie, stands on his own, though. He's a great surgeon. He's really skilled and loves not only those primary, but really loves those complex cases because those make him really think out of the box about how he can help his patients.
That's how we work on our brain, right?
Accepting. That's right.
I have like 2 doctors now, and then I gave Adam, shout out to Adam. Are you still here, Adam? No, he went out for lunch. He came in. We had a patient, TMJ and everything, and he hadn't treated any TMJ lately. He's like, "Oh yeah, man, I like this, Dr. Mike." So yeah, shout out to Adam, and then Wu, also one of our students. So you mentioned about Nashville, Murfreesboro, Dixon, Union City, and Brentwood. So
Yes.
I've been interacting before with Dr. DeBauer. He's
Dr.
in
DeBoer?
Union City, right?
Dr. DeBoer is in Union City. He both sees patients there, ASC that he will operate in as well. And then he also, there's some more complex patients that he'll go ahead and bring to Nashville.
Yeah,
So
shout out to Dr. DeBauer.
Yeah,
I used to get referrals from him. So when I was, I still lived in Martin, but yeah, thank you very much, Dr. DeBauer, for all those referrals. So
definitely get you guys connected again.
I know, right?
Sure.
So again, of course, the common question, that we always get, what are the different insurances that you accept?
Yeah.
And then, so I see
Sure,
it here. So
that's a great question. I would say most all major insurance plans are going to find coverage. Your things like Aetna, Blue Cross Blue Shield, Cigna, Coventry, First Health, Health Alliance, Humana, a lot of the multiple plans. We do Medicare, Medicaid.
There you go.
We also do
a
lot of military plans. There's a lot of military that we want to make sure they've taken care of us in our country. We want to make sure that we take care of them.
Yep.
So we see
it
a lot
here.
of military plans as well.
Common question.
Okay.
Co-pays, out of pocket, or is it all covered by their insurance? I know I'm putting you on the spot.
I'm also not a billing person, but I would say, contact your provider, commercial payer plan, and just let them know what you're, looking to have done, or call our office. That would be an easier step probably because we do this every day. So you can at 615-342-0038, ask any questions, let them know what insurance plan you have, and they can look and tell you what your coverage would be, what your co-pays might be, and any out-of-pocket expense.
There you go. I was going to ask you that next. What's your telephone number? And I'm putting up the website. So could you please tell us your website?
Sure. Again, that phone number is 615-342-0038, and our website is it's just www.sjri.com.
All right. Well, thank you very much again, Ms. Tonya. I appreciate you. But before I let you go, always remember the word fast. FAST. Why? Because you gotta take action fast. I was just telling Ms. Tonya earlier, hey, you want to do this? And she's like, okay, let's do it. So sometimes you have to take action fast. Not sometimes, all the time. All right. Letter F. Find people that will bring out the best in you. Find people that will push you to your next level. Well, guess what? If you have hips and shoulder issues, find a surgeon that will bring out the best in you. Talk to sjri.com.
And I would love to give you a plug because we work hand in hand with great physical therapists, and those guys really make a difference in the outcomes for patients.
Yep.
So after surgery, we're going to put you with someone like this man so that you can get the best outcome available. Very important in that surgical outcome.
There you go. Yeah. So I like what she said. Before fast, you have to get follow through. There needs to be a follow through, because you can have all the surgery in the world, but if you don't have a follow through of therapy, physical therapy, or any kind of wellness program, it's not going to do you good. The recovery, don't expect the doctor to give you 100% recovery if you yourself don't want to recover yourself, or not going to do your therapy or your physical or your wellness program. So you got to have that follow through. Okay, that's very important. So letter F again, find friends, find a surgeon that will bring you. You know what's the next letter? Is letter A. Take action. All the stuff that we're doing is not going to do me good. It's not even going to do Ms. Tonya good if you don't take action. Take action. Go to their website, sjri.com. Call their number. Go to their website. Talk to them. Hey, what's my option? Do I really need this? Do I really need that? Okay, so take action. Next letter is letter S. Share and subscribe. Do you have Facebook for your website?
Yes, they can just Southern Joint Replacement Institute for our page. They can go there. We have a lot of updates, patient stories, physician helps. They even talk about non-surgical options or causes of inflammation and why you may be going through joint pain. So really important to stay in touch with our Facebook page as well, social media.
There you go. Share and subscribe their Facebook page, because that's very important, because sharing is caring. Sounds cheesy, right? But it is.
It's true.
It may not be applicable to you, but it could be applicable to someone else. All right. And then last but not least is letter teach it. Why? Because when you hear it, you forget. When you see it, you remember. But when you're actually teaching it, just like what Ms. Tonya's doing right now, she's teaching us, right? You actually understand it more. Again, thank you very much, my Facebook friends, Jerry Had Podcast, YouTube, wherever you're watching right now. Thank you very much, Ms. Tonya. Thank you very much. I appreciate you. Be awesome, be great, be excellent, and we will see you later, my Facebook friends. Bye-bye.